This is Ada coming in to do a video on KIP. Um, this is the supplement that I take, and it's by Solar Ray. And as many of you know, KIP contains iodine, and our bodies need iodine. And I specifically want to talk to the women about female health. Iodine is an essential mineral that we need in our body. A lot of times we get our iodine from seafood. We get our iodine from seaweed. If you eat seaweed, we can get iodine from miso soup, but we do need iodine. And up until the early 1900s, they started adding iodine to the salts, the processed salt, of course. They started adding iodine because a lot of people were getting garters. And I want to say it was in 1920s or 30s that they started adding iodine to the salt because people were having these huge garters on their throat. And so even though that was good to help with garters, of course, the body needs a lot more iodine than we typically get in, our salt. And those of us who may not use the typical salt that you get from the supermarket that's processed, but use the Himalayan salt or the kosher salts, you're probably most likely to get all your minerals, including your iodine, which is the healthiest, in my opinion. So I want to talk about KIP because years ago I was having issues with my thyroid. And of course, I was going back and forth to my doctor, and they couldn't find anything wrong. But I had all the symptoms of a thyroid issue. And I later learned by doing my own research that sometimes when you have hypothyroidism or what have you, it doesn't always show up in the blood work unless they do very specific tests. And the way the insurance companies are designed now, most of the time they're not going to do those tests unless you request them. And if you're just the average person who don't know anything about lab testing or your thyroid or anything, like you wouldn't know. You just simply wouldn't know. But anyway, by me doing my research, I learned that my body needed iodine. And I started taking KIP, and a lot of my issues disappeared, which I was having some issues back then. That was like 20 years ago with cysts and painful cysts, and they didn't know what was causing all the pain. I later found out from my gynecologist that I had small cysts, and they were painful. So, long story short, my hair had started falling out in the top, and I was having numerous issues. I gained weight. I just blew up for no apparent reason. And so in all the research that I did, I'm like, okay, this looked like I may have some thyroid issues. So I started taking the KIP. And needless to say, taking the KIP and drinking green tea, I just shrunk back. I mean, all the weight left. My hair started growing back just from adding that mineral that I needed. So here years later, I stopped taking it. I stopped being as conscientious, and I started having issues again. So needless to say, guys, I'm back on the KIP to help with my thyroid to balance it out. And of course, now if you just go get the average thyroid test, and it's not going to show. And I have been testing, it's not showing. But me, who have worked in a lab, and I've been around a lot of medical stuff, I kind of know, what to ask for. And I also know, how to help myself because I have in the past. But anyway, I'm going to go on and finish discussing the benefits of iodine. Women need iodine for breast health because if you have fibrocystic breast disease, there could be an iodine issue where you get lumpy breasts or what have you. There could be an iodine issue because our breasts need iodine. Our ovaries need iodine. Men prostate need iodine. It's a very important overlooked mineral. And a lot of people are iodine deficient and they don't know it unless you eat a lot of seafood and you're very conscientious, it could be that, some issues are caused by a deficiency in this mineral. Okay, so iodine is beneficial to your heart and your thyroid, digestion, your metabolism, energy. It helps balance out your body temperature. Um, it helps with your sleep, breast, skin, bones, hair, reproductive system, brain, glands, your cognitive function, your immune system. It helps prevent cancer, especially cancer of the ovaries and of the breast. Um, and iodine deficiency can wreak havoc on a woman's health, as I just told you. Insufficient iodine levels often lead to poor thyroid health, and which can cause many health problems, including low energy, hair loss, weight gain, ovarian cysts, fibrocystic breast disease, where you have lumpy breasts, breast pain, fibroids, and infertility. Studies have found improvement in the above and other symptoms with iodine supplementation. While women needs for iodine may be more noticed or diagnosed, men need iodine for proper body function as well. Men specifically need iodine for proper prostate function. In Japan, where iodine consumption is high, prostate cancer is low. And so the Japanese eat huge amounts of seaweed, and they get huge amounts of iodine in their diet. And so here in the States, we've been told that we only need 150 micromilligrams, which is a very small amount. So in this kelp tablet that I take, I'm currently taking one a day, just to err on the side of caution, but I'm getting 550 milligrams, not micrograms, but milligrams of iodine in this supplement. Um, so I said all that to say this. I started having a lot of those symptoms about a year ago of the fatigue, the hair loss, skin issues, all kinds of stuff going on with my health. And so a month, not only did I start supplementing again with iodine, I also started doing like my vitamin D, magnesium, and my other important minerals, because we need all those minerals before our body to function properly. Okay, and here I'm gonna read on this old website that I used to read on years ago. I learned a lot through this site before, the days of YouTube. Calcium iodine. Iodine has been found to be cytotoxic to some types of cancer cells, including colon, breast cancer cells. In other words, it appeared to kill cancer cells. Providine iodine, Lugol's iodine, and a combination of iodine and iodide were each found to have some degree of effectiveness. Not only a potential cancer treatment, iodine may be a cancer preventative as well. Low dietary amounts of iodine has been associated with increased risk of ovarian, breast, and endometrial cancers. And some families, may have a history of goiters, which I do on my father's side. They had a history of goiters, which tells me, I may need more iodine than the average person, because, we're all different. But everybody need, iodine in their diet. Okay, now iodine is also effective on treating infections. In addition to being a basic need for a daily body function, iodine is an effective topical antibiotic even for serious infections like MRSA. Iodine also fights fungal infections like tinea, that's ringworm. Certainly, iodine has a long history in hospital and is used to prevent surgical infections. More recently, combinations of antibiotics and iodine have shown encouraging results against Lyme disease bacteria. So one may ask, what causes iodine deficiency? Unfortunately, it is estimated over 2 billion people suffer from iodine deficiency. The body's only source of iodine, apart from supplementation, is from food. So if you're not eating a lot of seafoods, which contain iodine, or I know prunes contain iodine, but a lot of foods that have, or some foods that have iodine, you may have a deficiency. Sea vegetables are high in iodine. but not many people have local access to sea vegetables or choose to eat them even if they are imported. Modern diets are high in processed foods. Processed foods tend to contain very little, if any, iodine. While table salt is iodized, I do iodine, iodize have iodine in it. The salt also added to processed foods is not. So, that's the problem. It used to be the iodine was added to bread as a preventative message. Then they stopped putting iodine in the bread and start adding bromide, which the iodine is, was helpful in preventing goiters. So when they started putting bromide in the bread, I mean, they stopped putting the iodine, and they had an increased rate of goiters. Unfortunately, not only did this remove an iodine source from modern diets, bromide competes with iodine in the body. So you got two chemical compounds. You got your bromide and your iodine, and so they compete for the same receptors in the body. So when they added bromide to the bread, it also competes for the iodine. So even if you are getting iodine, if you eat the bread with the bromide in it, you're more likely to have a deficiency. So hold on, guys. Okay, so table salt is iodized. They add iodine to table salt, but it's processed, so it's not the healthiest form of salt. However, many choose less processed forms of salt like sea salt and do not receive the supplementation. And another thing, people who may be on a salt restrictive diet may not be getting the iodine that their body needs. So that's another thing to think about. People on restrictive diets. Okay. Additionally, the amount of iodine in table salt is minimal. It meets the RDA, but in many cases, that amount of iodine is only enough to prevent goiter. So the 150 micromilligrams that they tell us that we need, that's only to prevent a goiter. That doesn't take in your thyroid need iodine to make other hormones. Your breasts need iodine to be healthy and not to get these lumps in them. Your ovaries need iodine, to function properly and not get ovarian cysts or cancer even. So we need iodine. And if the amount that we're getting in the salt, even if you are using the iodized salt from the supermarket, you're only getting a very small amount of iodine from that source. So, what are the options? Okay. The food sources of iodine are kelp, like I just showed you. And, I do have kelp in as a season. I have some kelp seasoning that I can sprinkle on my food. So they do have that. You have the wakame nori wraps, and you can get that probably from the Asian market. But that contains iodine. A lot of dairy products have iodine. I don't know if it's enough to meet, your daily allowance. Cranberry, strawberry, some grains, navy beans, tuna, codfish, potatoes have iodine. Herbal sources of iodine are black walnuts. It's a great source of iodine. The hulls of black walnuts are rich in iodine. Even removing the green hulls will stain the hand just as adequate iodine solution would. Black walnut is used by herbalists for oral health. Indeed, iodine has been found to fight cavity-causing bacteria in the mouth. Okay, iodine supplementation. There are a variety of ways to supplement. Lugos, as I mentioned, that's one source of iodine. There's potassium iodine, there's Iodora, and there's kelp supplements, which I just showed you. There are black walnut supplements that, you can take. They are full of iodine, as I read to you. And so iodine also have these companion nutrients that you need as well. When you need selenium, zinc, vitamin C, magnesium, and B vitamins when supplementing. And some people even do the skin pain, to test to see if they need iodine. You can get the provolone, what is it called? It's the red iodine that they use in the hospital that they put on wounds. But if you want to test to see if you have enough iodine, you can take that, the red iodine that you buy at your local drugstore, and put it on. And if it soak it up and you can barely see it, the next day most likely you need iodine. So iodine do have some side effects if you take too much. And if you have hyperthyroidism, which is thyroid that works too fast, and you feel anxious or jittery and what have you, it can have some side effects. That's why you have to be cautious, to make sure that you're a candidate for it. And so there's a lot more that I could talk about on iodine, but I'm going to wrap it up. So a few more benefits I'm going to run through right quick. It may be useful for swollen glands. Iodine has been used for swollen glands, joint disease, sexually transmitted diseases, gout, excess mucus, asthma, ulcers, edema, boils, and burns. So those are some of the things that iodine has been used for. So, if you choose to try iodine or what have you, do your research, consult with your physician. Because I'm not a medical doctor or a nutritionist and I can't give medical advice. I can just tell you how it benefited me through the years. So thank you for tuning in, and I didn't get to my scripture this time. I kind of forgot, but I will do it the next time. So you all have a blessed night. Thanks for watching.